neurofibromatosis type 1 is the most common of all the single gene disorders affecting the central nervous system. It has an incidence of 1 in 2,000 to 3,000, with equal male and female predilection, and affects all ethnic groups around the world. It's of autosomal dominant inheritance with about 50% incidence of new mutations. The gene is a large gene, and as I said, it's on chromosome 17, and it has virtually complete penetrance, but the expressivity is quite wide. So only about 40 to 50% of individuals would have significant clinical manifestations, and a large percentage of people go through life not being hassled or even perhaps knowing that they are diagnosed with neurofibromatosis type 1. The difficulty in the past was that we were unable to predict complications or severity, but that is slowly changing with genotype-phenotype correlations. This is the only slide I've added about neurofibromatosis type 2, because with the cloning of the NF1 gene and the NF2 gene a few years later, in 1993, we now understand that these two conditions are completely separate diagnostic entities, both genetically as well as clinically. NF2 is usually diagnosed in the second decade or even later, and the hallmark is usually bilateral vestibular schwannomas and these patients may also have other schwannomas as well. These were previously called acoustic neuromas. The lifetime risk of meningiomas for NF2 is much higher, and they might not have as many cafe au lait macules as is seen in NF1.